How to get an autism diagnosis in Ontario. Do you have concerns about your child's development? Have you brought them up to your child's physician? Are you wondering how to get an autism assessment? At your child's 18 and 24-month checkups, the doctor should be screening them for autism. They're likely using a tool called the MCHAT-R. The MCHAT-R is 20 questions about your child's behavior. No screening tools catch every child, so even if your child passes the MCHAT-R, you can still request a referral to a specialist for further testing. There isn't a blood test or a scan that you can do that will show autism. The person will use formal assessment tools and their clinical judgment. Diagnosticians need to have a lot of training and experience identifying autism. 3 paths to an autism diagnosis. A family physician, a pediatrician, a developmental pediatrician, a neurologist, or a psychiatrist can all diagnose. Many physicians do not give a detailed report of the child's level of functioning, but will simply write a diagnosis letter. OHIP pays for this assessment, and it won't cost you anything. There could be a wait to be assessed. There are 5 diagnostic hubs in the province. They use a multidisciplinary approach and use standardized tests. The people on the multidisciplinary team are a psychologist, an occupational therapist, a behavior analyst, and a speech pathologist. The provincial government pays for the assessment if it's done at a hub. The wait for an appointment can be over a year. You'll get a written report describing your child's behavior and current level of functioning. The hub will give you a list of many resources in your community where you can turn for help. The diagnostic hubs in Ontario are at McMaster's Children's Hospital, Ron Joyce Children's Health Centre, the Children's Treatment Network of Simcoe York, Child and Community Resources, Children's Hospital of Eastern Ontario, and Holland Bloorview Kids Rehab Hospital. Some families choose to use a psychologist to provide the assessment and diagnosis. Because the family is paying for the services, usually the assessment can begin within the month. Autism testing can cost between $3,000 and $5,000. The psychologist will interview you and will do standardized tests with your child. Many psychologists use a test called the ADOS, or the Autism Diagnostic Observation Schedule. What happens at the appointments? First will be a parent interview, then a few child assessment sessions, and finally discussions of findings and referrals. Does your child need a diagnosis to begin receiving treatment? No. Early intervention is possible while you're waiting for the diagnostic appointments. Let's connect to talk about your child, online at sidebysidetherapy.ca, by email at info@sidebysidetherapy.ca, or by phone at 1-647-955-5995. Side by Side Therapy, empowering parents to empower their children.